If you're over 60 and you've noticed your legs feeling heavy, swollen, or tingling by the end of the day, I need you to stop what you're doing and listen closely, because what I'm about to share could change the way you move for the rest of your life. My name is Dr. Thorne, and I've spent over 2 decades in the operating room, treating patients whose legs were failing them, not because of age, but because of one overlooked habit almost nobody talks about. I've seen the fear in their eyes when they're told, it's just circulation, it's just age. But I'm here to tell you, it's not just age, and it's not something you have to live with. Today, I'm going to reveal the single exercise I give my own patients, the one that takes less than 5 minutes, requires no equipment, and works directly on the root cause of poor leg circulation. This isn't theory. This is what I use in my own practice, and it's changed thousands of lives. So if you're ready to take your circulation and your independence back into your own hands, stay with me, because what you do in the next few minutes could matter more than anything your doctor has told you so far. Let's talk about something most people over 60 have felt but never really understood, that heaviness in your legs by the end of the day, that dull ache after standing too long. The swelling around your ankles that seems to appear out of nowhere. Maybe you've noticed your feet feeling colder than they used to, or a strange tingling sensation when you sit for too long. If any of this sounds familiar, you're not imagining it, and you're certainly not alone. For years, I sat across from patients who described these exact symptoms, and almost every single one of them had been told the same thing by well-meaning doctors. It's just age. It's just how the body slows down. There's not much you can do about it. And I understand why that explanation gets repeated so often. It's simple, it's easy to accept, and frankly, it lets everyone off the hook. But here's what 20+ years in the operating room taught me. That explanation is incomplete, and for many people, it's simply wrong. Poor leg circulation after 60 isn't primarily a story about aging, it's a story about movement, or more specifically, the lack of it. Here's what's happening inside your body. Your heart is a powerful pump, but it can't do the job of circulation alone, especially when it comes to your legs. Getting blood back up from your feet and calves against gravity, all the way back to your heart, requires help. That help comes from your leg muscles, particularly the muscles in your calves. Every time you contract them, through walking, standing on your toes, shifting your weight, they squeeze the veins around them like a secondary pump, pushing blood upward through a series of one-way valves. This is called the calf muscle pump, and it is, without exaggeration, one of the most underappreciated systems in the entire human body. When you're young and active, this pump works constantly, almost without you noticing. But as we get older, our daily movement naturally decreases. We sit more, we take fewer steps, we spend more time in chairs, in cars, in front of screens, and when that calf muscle pump slows down, blood begins to pool in the lower legs. Pressure builds. Fluid leaks into surrounding tissue. That's the swelling you see. That's the heaviness you feel. That's the ache that shows up by dinner time. Now here's the part that surprised even some of my colleagues when I started explaining it this way. This isn't a one-way street where things only get worse. The calf muscle pump can be reactivated. It's not a switch that turns off permanently at a certain age. It's a mechanism that simply needs to be engaged again, consistently and correctly. I've seen patients in their 70s, even their 80s, restore meaningful circulation function just by reawakening this pump on a regular basis. What makes this especially important to understand is that poor circulation isn't just uncomfortable, it's a signal. Left unaddressed, it can contribute to more serious issues down the road. Chronic swelling, skin changes, increased risk of clots, even mobility problems that limit independence. So when I talk to patients, I don't want them thinking of tired, heavy legs as a minor annoyance to tolerate. I want them thinking of it as their body sending a very clear message that the pump needs help. This is exactly why I stopped simply telling patients to walk more and move around as vague advice. It wasn't specific enough, and frankly, it wasn't giving people something they could act on immediately in their own living room, without any special equipment or gym membership. What they needed was one precise movement that directly targets this pump, something simple enough to do daily, gentle enough to be safe, and effective enough to make a real measurable difference in how their legs feel by the end of the day. Now let's get to what you've really been waiting for, the exercise itself. And I want to say up front, because I know how these things usually go, this is not a complicated routine. It's not a series of movements you need a physical therapist to demonstrate, and it's not something that requires resistance bands, ankle weights, or a single piece of equipment. What I'm about to describe is something you can do sitting in a chair, standing at your kitchen counter, or even lying in bed. That simplicity is not an accident. It's the entire point. The exercise is the heel raise, sometimes called the calf raise, but performed in a very specific, deliberate way that most people get wrong when they try it on their own. Here's how it works. You begin either standing, holding onto a countertop or the back of a chair for balance, or seated with your feet flat on the floor. From there, you slowly rise up onto the balls of your feet, lifting your heels as high as comfortably possible, then just as slowly lower back down. The key word here is slowly. Most people rush this movement, treating it like a quick bounce, and in doing so, they miss the entire mechanism that makes it effective. Remember what we discussed about the calf muscle pump, that secondary pumping system that pushes blood back up toward your heart. Every time you raise your heels and contract your calf muscles, you are directly engaging that pump. You're squeezing the deep veins in your calves, forcing blood upward through the one-way valves designed to prevent it from flowing backward. When you lower slowly rather than dropping quickly, you extend the time your muscles spend under controlled tension, which enhances the pumping effect even further. I typically recommend starting with 2 to 3 sets of 10 to 15 repetitions, once or twice a day. That's it. Less than 5 minutes, morning or evening, or both, if you'd like to see faster results. For those who are a bit more stable on their feet, you can progress by doing this on a stair edge, allowing your heels to dip slightly below the step before rising, which increases the range of motion and intensifies the pumping action. But I want to be clear, that progression is optional. The basic version, done consistently, is where the real benefit comes from. What makes this particular movement so effective compared to general advice like walk more is precision. Walking is wonderful, and I always encourage it, but it doesn't isolate and repeatedly engage the calf pump with the same concentrated effect as a deliberate heel raise. Think of it this way. Walking is like watering an entire garden with a hose, while the heel raise is like directing that hose precisely where the driest patch of soil is. Both have value, but one addresses the specific mechanism we're targeting far more directly. Patients often ask me if they'll feel it working, and the honest answer is yes, though not always immediately. Some people notice a warm sensation in their calves during the movement itself, which is simply increased blood flow doing exactly what it's supposed to do. Over days and weeks of consistent practice, most people report that the evening heaviness diminishes, the swelling around their ankles reduces, and their legs simply feel lighter and more alive by the time they sit down for dinner. What I appreciate most about recommending this particular exercise is its accessibility. It doesn't matter if you have limited mobility, if you're recovering from a hip or knee procedure, if you live alone, or if you simply don't enjoy structured exercise programs. This movement meets you exactly where you are, whether that's holding onto a wheelchair, standing at the sink while brushing your teeth, or sitting in your favorite chair during a commercial break. There's no excuse of time, location, or ability that stands in the way of doing this every single day. Now I want to address something important, because I've seen it undo the progress of countless well-meaning patients. There's a habit, one so ordinary, so woven into daily life, that almost nobody thinks to question it. And it is quietly working against everything we just talked about. In fact, for many people, this single habit does more to worsen leg circulation than age itself ever could. That habit is prolonged, uninterrupted sitting. Not sitting in general. Sitting is a normal, necessary part of life, and I'm not here to tell you to stand for 8 hours a day. What I'm talking about is sitting for long, unbroken stretches, especially with your legs bent at the knee and your feet flat on the floor for extended periods, without ever engaging that calf muscle pump we discussed. Think about a typical afternoon. Sitting to read, sitting to watch television, sitting in the car, sitting at the dinner table. For many people over 60, especially those who are retired or have reduced mobility, these sitting stretches can extend for 1, 2, even 3 hours at a time without a single break. Here's why this matters so much physiologically. When you sit with your legs bent, you create a kind of double problem. First, the calf muscle pump goes completely idle. There's no contraction happening, so blood isn't being actively pushed back up toward the heart. Second, the bend at the knee and hip can actually compress the blood vessels running through that area, partially restricting the very pathway blood needs to travel through. So you have reduced pumping action and increased resistance to flow happening at the exact same time. It's like turning off a water pump while also pinching the hose. Over the course of one sitting session, this might not cause dramatic problems. Your body is resilient, and short-term pooling reverses itself once you stand and move. But here's what I've observed in decades of practice. For most people over 60, this isn't an occasional occurrence. It's the default pattern of daily life, repeated hour after hour, day after day, for years. And that chronic repetitive strain on the venous system is precisely what accelerates the swelling, the heaviness, the visible veins, and, in more serious cases, contributes to the risk of blood clots forming in those stagnant pools of blood. What troubles me most is that many of my patients were already doing the right things by conventional wisdom. They were eating reasonably well. They were taking their prescribed medications. Some were even walking regularly, just as their doctors advised. But they were undoing much of that benefit by then sitting for hours immediately afterward, with no awareness that this simple, unremarkable habit was working directly against their circulation. So what's the fix? It's not complicated, but it does require intention. The goal is to interrupt sitting every 30 to 45 minutes, even briefly. This doesn't mean a full workout or even a long walk around the house. It can be as simple as standing up, performing a few of the heel raises we discussed earlier, shifting your weight from foot to foot, or simply flexing your ankles up and down while still seated if standing isn't easily accessible in that moment. The purpose is singular. Reactivate that calf muscle pump before too much time passes and blood has the chance to pool and stagnate. I often tell my patients to think of their circulation like a river, not a still pond. Rivers stay healthy because they keep moving. The moment you dam that flow for too long, sediment settles, pressure builds, and problems begin to accumulate. Your leg veins function the same way. They were built for movement, for regular contraction and release, not for hours of stillness followed by brief bursts of activity. Recognizing this pattern and consciously breaking it up throughout your day is just as important as the exercise itself, because one without the other leaves you fighting an uphill battle against a habit working quietly in the background every single day. I want to leave you with something that I consider more important than the exercise itself, more important than understanding the calf muscle pump, and more important than recognizing the dangers of prolonged sitting. And that is this: none of what we've discussed today works as a one-time fix. I say this because I've watched it happen too many times in my practice. A patient comes in, learns about the heel raise, feels inspired, does it diligently for a week, notices real improvement in how their legs feel, and then life happens. They get busy. They forget. The exercise falls away, and slowly, quietly, the heaviness and swelling creep back in. This is perhaps the most important distinction I can make for you today. What we've talked about is not a cure in the way we typically think of cures, something you do once and the problem disappears forever. It's a maintenance system. Your calf muscle pump doesn't stay activated because you engaged it once, or even once a week. It stays functional because you engage it consistently. The same way your heart stays strong because it beats continuously, not because it took a particularly good beat on a Tuesday 3 months ago. I like to compare this to brushing your teeth. Nobody expects that brushing their teeth for a week will permanently prevent cavities for the rest of their life. We understand instinctively that oral health requires ongoing care, day after day, for as long as we want to keep our teeth healthy. Yet somehow, when it comes to circulation, we often fall into the trap of thinking a short burst of effort should produce permanent results. It doesn't work that way, and I'd be doing you a disservice if I implied otherwise. The good news is that once this becomes a routine, rather than a conscious effort you have to remind yourself to do, it stops feeling like a chore. I've had patients tell me that after several weeks of consistent practice, they find themselves doing heel raises while waiting for their coffee to brew, or while brushing their teeth, or during television commercials, without even thinking about it. It becomes woven into the fabric of their day, the same way checking a mailbox or locking a front door becomes automatic. That's the goal. Not willpower sustained indefinitely, but habit formation that removes the need for willpower altogether. I also want to address something I hear often, which is patients feeling discouraged if they miss a few days or even a week. Let me be clear, missing days does not erase your progress entirely, and it certainly doesn't mean starting from zero. The body is remarkably responsive when you return to consistent movement, and circulation function tends to improve again relatively quickly once the habit resumes. What matters far more than perfection is the overall pattern over months and years. Are you on the whole moving your calf muscles regularly? Are you on the whole breaking up long periods of sitting? If the answer is yes most of the time, you are doing exactly what your legs need. What I find most rewarding after all these years isn't just the physical improvement patients experience, though that matters greatly. It's watching them regain a sense of control over something they had previously accepted as an inevitable consequence of aging. So many people walk into consultations believing their legs are simply betraying them, that this is just what happens after 60, and there's nothing to be done except tolerate it or accept increasingly invasive interventions. What I hope you take away today is that this isn't the full picture. Your circulation responds to how you treat it. Your calf muscle pump can be reactivated and maintained well into your 70s, 80s, and beyond, provided you give it the consistent attention it requires. This is why I always tell my patients that the exercise itself is simple, but the commitment behind it is what actually determines the outcome. 5 minutes a day, broken sitting patterns, and genuine consistency over time will do more for your leg circulation than any single dramatic intervention ever could. And that consistency, more than any other factor, is what separates those who see lasting change from those who experience only brief, temporary relief. So here's what I want you to remember. Poor leg circulation after 60 isn't a life sentence, and it isn't simply what happens with age. It's a signal. Your body asking for movement it isn't getting. The heel raise we covered today takes less than 5 minutes, requires nothing but your own body weight, and directly reactivates the very pump your legs depend on. Pair that with breaking up long periods of sitting, and you have a simple, sustainable system that can genuinely change how your legs feel by the end of every single day. I've seen this work for patients well into their 80s, and I believe it can work for you too, but only if you actually put it into practice, starting today, not someday. If this was helpful, do me a favor and subscribe so you don't miss the next video. And drop a comment below. Tell me how your legs feel after your first week. I read every single one.